Hello, I'm Julianne Good, and this is Psych One-on-One on Therapy Cable. Welcome. Today, I'm going to be talking with Susan Kelsey, MFT, and we're going to be discussing children and therapy and all the different aspects of it. Welcome, Susan.
Thank you. Thank you for having me.
Thank you for being here. I'd like to discuss with you a little bit about your background. Can you tell us a little bit about yourself?
Sure. I'm a licensed marriage and family therapist, and I am also a registered play therapist supervisor. And I decided very early on in my internship and early education in therapy to focus my treatment and practice entirely on children. So I actually see no adults. I see only children. And the reason why I did that is because I learned that treating children is very different than treating adults. So my entire practice is focused toward a child's needs. So I worked in agencies, of course, like most of us when we're pre-licensed. I worked in agencies, working with children there, and then eventually went to private practice. And at first saw adults and children, but have, through the last, I'd say, 10 to 12 years, focused entirely on seeing children. So that is my passion, and I'm happy to be here to talk about it with you today.
And we thank you for being here. Now, what led you to just be working with children?
I've always enjoyed children. I've always been fascinated by children and their behavior. I have a degree in neurobiology, and I have always been fascinated in human behavior and the link between the body and the mind. And children are like a developing nervous system that is developing right in front of you. And I think that if you have a chance to intervene at the level of trauma or at a child's level, you have a chance to save the child from further suffering in their life when they grow up. So I think it's a worthy place to focus treatment so that we have fewer and fewer adults in therapy when they grow up. So.
Rightly so. I agree. And with the neurobiology background, I'm sure that comes in handy for really assessing a child properly. And getting in not only from a counseling perspective, but going in and trying to figure out what is going on with this child, maybe chemically. So have you done a little bit of that work with the children that you've worked with? Yes,
I have. It's very important to understand what happens in a child's body, and we'll be talking about that today. Some of the things that happen that happen when children are traumatized, for instance. And also if a child is in need of medication, how that medication works and what sort of things you can expect as a result of that. It's a very helpful background. I'm glad I have it. It's come in handy, that's for sure.
And I'm sure that's given you a one-up on just regular children's therapists because of having that additional education.
I think so. I think so. People often ask me, how did you leap from neurobiology to child therapy? But it really isn't much of a leap at all. I think it's a natural understanding to be able to do this, to know a little bit more about how the nervous system works and what happens when it's not working so well. It's really a gift to be able to have both in your background, I think.
I would imagine, and very helpful for your clients and their families.
Yeah.
Definitely. Yeah. So that's fascinating. So how does therapy with children differ from working with adults?
Well, it's very different. And I think that's one of the reasons why I decided to just focus on children completely, is that children and adults do therapy completely differently. I once heard that doing therapy with words with children is an inappropriate use of an adult strategy on children. So children don't do therapy using words. And most of us who have tried to do therapy with children and haven't had the training realize that when you sit a child on the couch and you say, why are you kicking kids at school? You're not going to get an answer like, my parents are going through a divorce and I'm angry and I'm taking that out on everybody. Children are unaware even adults are unaware, but adults are more insight-oriented, and children are not insight-oriented that way. They haven't developed enough yet. So to do an insight type of therapy using words is very difficult for children to follow, and you don't get very far. And most parents realize this, that children think differently. If you've ever had a child, a very typical conversation is, how was your day? Fine. What did you do? Nothing. And that comes out of the mouths of every child, because they don't think, it's not that they don't want to share or that they really did nothing. They did lots of things, but they don't think the same way that adults do. For instance, an adult can tell you literally word for word, I got up in the morning, I brushed my teeth, and they can tell you in a very linear way how they navigated through their day. Children don't think like that yet. Their brain has not organized enough to think in a linear way. So their memories and their memories of the day are like in a pile. And to get them, you have to be specific. How was your science fair project today? How did that go? And they can answer that. How was your test in spelling? How did that go? They can answer that. But if you ask them generally, their memories are not stored the same way ours are, and that impacts how we do therapy with children. Their memories are not stored the same way, they don't think the same way, and they don't respond to adult interventions the same way adults do.
So about what age group would that fall true, that they think in that kind of a piled up sort of message system?
Certainly pre-adolescence. Pre-adolescence. I think their brains start organizing more during adolescence. Not that they're completely organized yet, but they're certainly getting there.
Right.
But a pre-adolescent child doesn't think the same way as an adult. And then it depends on their development during adolescence when that takes place. So, sometimes, and especially if you're working with a traumatized child, they may be stuck at an earlier stage of development, and they may not have organized themselves yet anyway, even though they might be 15 years old. They might be more like they're 7. So there's a lot that depends on how you might work with a child that might still be in an earlier state.
Right. And then we'll talk about working with traumatized children a little bit later in the program, because it is fascinating. And since you have such an extensive background, I'm sure you can have the viewers get a little more understanding about what's really going on with children when they go through any kind of traumatic situation.
Sure.
So what usually brings a child into therapy, into seeing you?
Well, lots of things, actually. One thing I should say is I see children from toddlers to 18. So and I would say that probably 85% of my practice, the children are under 7, because not too many people can do that. They haven't had, not that they can't do it, they just haven't had the training. So I'm hoping a lot more people get trained to be able to serve young children who really need a therapist who understands how children do therapy, so that they can get served better too. So some of the things that would bring a child into therapy would be anxiety. Their family might be going through a divorce or a move or some sort of huge life-altering change. Maybe they're having behavior problems at home or at school. Maybe they have been diagnosed with ADHD or autism of some sort and need some help. You can't actually treat ADHD or autism using therapy exactly. That would be like saying you're treating diabetes using therapy. But you can treat some of the things associated with those conditions, like having the child be able to accept themselves and understand themselves. And children going through the process of grieving over being a normal kid or a regular kid like everyone else. So there's lots of other things, and social skills can be taught. Lots of other things, education about what they have and how that impacts them, and being able to move them through that and give an understanding to a child. Certainly those things can be done during therapy, but you can't actually cure ADHD doing therapy. You can help them, but you can't cure that, or autism, but certainly those things would bring a child into therapy. Some sort of sexual abuse, physical abuse, or emotional abuse. I see children with those conditions all the time. Anything that might impact a child so that they're not learning and growing and being successful navigating through their childhood would bring a child into therapy.
So it sounds like a wide array of issues and problems that are going on with a lot of these younger people.
Exactly.
Which, especially nowadays, I know there's a huge issue with bullying.
Mm-hmm.
And especially with the technology that we have nowadays, it's really rampant in Facebook.
Mm-hmm. Mm-hmm.
So do you see that as a big presenting problem nowadays? It's just children trying to get through that being exposed that much.
Mm-hmm. I don't see like media bullying as being a huge presenting problem.
Mm-hmm.
That often comes up during therapy, but mm-hmm. usually there's other problems. There are it's my belief that some children are easier targets than other children too. Some mm-hmm. children never get bullied, but they're not aggressive, or they just don't get bullied, and other children do get bullied. Not that every child couldn't be bullied at some time, but I think that sometimes children don't know how to present to another child that they're not really a target for bullying. We work on that in our office. We work on ways of helping prevent even becoming bullied in the first place, mm-hmm. or to get rid of a bully, and we're pretty successful in getting that to stop. There's a difference between teasing and bullying too. So you have to remember that teasing is normal, and they need to learn to navigate teasing to a point. Mm-hmm. And then when it gets too much, it can be bullying, that's for sure. But that does happen. That is a bigger problem, a huge problem nowadays with people being very mean. And there's a lot that goes into that. Parents watching to see what's happening on social media. There's a lot that goes. It's very complicated. We could have a whole show on that alone.
And we just may.
Yeah, I think it's a great subject.
I know a lot of the children that I see at Boys and Girls Club definitely have bully issues, and mm-hmm. some of them can't come in specifically for that. But, and you probably agree with this to a certain degree, that that may be the presenting problem. But once you start unearthing everything that's going on, mm-hmm. there's a lot more complex issues underneath the bullying. Mm-hmm. A lot of home issues, divorced parents, and just trying to build up the self-esteem of that little mm-hmm. one can be really difficult. And that comes in with mm-hmm. being able to protect oneself from mm-hmm. the bullying.
I think people prey on weak people.
Yes.
And I think that if you can strengthen that person, you can also just help them realize they have some control over their life, and that they don't have to put up with that, and it doesn't have to be part of their life. I'm not saying that it's the child who's bully's fault by any stretch of the imagination, mm-hmm. but I have found that by shoring them up, they can reduce the amount of bullying that goes on in their life.
Right, and just giving them a few skills to be able to deal with it at the moment, because
absolutely,
it's just such an in-the-moment situation. And, and now can you talk about a little bit of the ways that children think differently from adults? I mean, I would imagine it's more of in the here and now versus what you were talking about before with the, being able to plan things out a little bit more concretely.
Mm-hmm. That's very true. It is more in the here and now for children. Mm-hmm. And I often call it the diving board theory. Mm-hmm. You can, for instance, if you tell a child that you and their dad are getting divorced, and in June, and everything keeps going along normally until December, they don't really understand what you're talking about. They usually don't understand much of what you're talking about anyway, mm-hmm. but it's when things actually happen in the moment that the problems start arising. So I call it the diving board theory, because it's when you see the high dive from the sidelines, it looks really fun. But when you're standing on it looking down, it's completely different. Mm-hmm. It's a completely different perspective. So they don't really have an understanding. They can't really extrapolate into the future. It's hard for children to say, okay, my parents are getting divorced, so that means that, boy, next Christmas, where am I going to be, and how are we going to manage that? And they just don't think about the future like that. Mm-hmm. But then next Christmas comes, and the problems come during that time. So children are very much in the here and now, that's for sure. Mm-hmm. You're right about that.
Yeah, so that would make it a little bit challenging as a therapist, as parents, as teachers, if you don't really have that concept really down well, and you're trying to get them to think in adult terms.
Right.
It could be just completely challenging.
Yeah, very challenging.
So
very challenging.
What kind of techniques do you use in the therapy room to address that kind of an issue? Because I'm sure it's probably second nature to you at this point and how to deal with that.
Yes, and we're going to talk about that in great length, but what I will say is that a lot of people try to play games with children and get them to talk, and that doesn't work well, in my opinion, because they really, first of all, children oftentimes don't like to directly address the problem. It's too overwhelming psychologically for them. So there are ways that we can have them address the problem in a more roundabout way that's safer for them psychologically, because children, you have to remember, have not fully developed, and their nervous system isn't fully developed, and they can handle less of that than we can as adults, and it's hard for us to directly face our problems. So it doesn't matter, though. We can still help them by indirectly helping them face their problem. And that would be similar to when somebody comes up to you and says, I have a friend who's having marital problems. And this friend, and they explain the marital problems, and you say, well, why don't you have your friend try this? And they leave. It's so much safer for them not to say that it's them.
Right.
But the help has still been obtained for that. So, and even adults oftentimes need a little bit more roundabout way of getting to the point in the issue, but it still can be effective. Some children can face things head on, and you can certainly work with children to get them strong enough to do that. But usually, especially at the beginning, you're not going to have children coming to you that feel that they can face things right away. So it's nice to have safe ways of addressing problems and working through problems that the child can tolerate, and especially if the child's been traumatized. That kind of work takes a lot of patience and a lot of time.
And a lot of trust building, too.
A lot of trust building.
Which is not, I think all of us, to a certain degree, have a level of difficulty building trust in the everyday world, but it's especially significant for those who have been traumatized, because their basic level of trust has been sometimes ripped away from them.
Very true. And I also would expect that if a child has a healthy emotional is emotionally healthy, that they would need to take time to build trust. Yes. It's not emotionally healthy to just spill your guts to everybody. If you're in line at the grocery store and the person next to you is telling you their personal problems and you don't even know them, you want to run to your car and get away because that person isn't okay. Yeah. I would expect that if a child is a typical child that has pretty good mental health, they're going to need some time to feel good about sharing some of the difficult things in their life. And that's normal. I would expect that. If a child comes in and just spills their guts the first session, sometimes the child's just in so much pain they have to, or they're all over the place emotionally. They don't know good boundaries. I would expect that a child would need some time to build a trust between the therapist and the child. And we as adults, and maybe as parents as well, have a different perception of a child in therapy, how much control that child actually has over the therapy process. You have to be willing to relinquish the control to that child. And that's difficult sometimes, but it's completely necessary for that child's treatment and their well-being.
And I think that's a good point too, Susan, in that sometimes we just need to take a step back and saying, as adults, saying you should do this, maybe you can try that, trying to fix it, and so I agree with you. That's really difficult, but it's so necessary to just let them take lead sometimes.
Yes. Well, and if we see an adult, we certainly would not see an adult and say, here's what I want you to do, here's what I want you to talk about today, I want you to do it this way, you have no choices. We certainly would want to pick up cues from our client as to where they want to go with the session. We want to fulfill their needs, what is most pressing for them right now, and we don't tell them what to do. We ask them, what do you think you want to do? How do you think you would handle that? What would be your next step? We need to afford the same respect to a child as we do to adults. So there's a lot of giving up when you see children, but it actually can make you a way better therapist and a way better person. If you do this and practice this, it kind of infiltrates your whole life. Mm-hmm. It's really a gift.
That is a gift. And we'll talk more about that. We're going to come back with our next segment, and we're going to discuss some therapy strategies for children. We're going to take a break right now for our sponsors. We'll be right back.
Hi, welcome to Adelante. This is Adelante Recovery, and my name is Yvette Kuglin, and I'm part of the staff.
Adelante Recovery Center has helped people in dual diagnosis for 5 years. We accept most PPO insurances and provide luxury accommodations and 24-hour support. To speak with an admissions counselor, call 1-888-242-4450.
A lot of time we don't even know what's wrong with us, and sometimes we need to get away to figure that out. So if you want to go for a little retreat out in Corona Del Mar, which is a confidential location, we're here to help. So we're only a phone call away. Thank you.
Hi, welcome back to Psych 1-on-1 on Therapy Cable. Nice to have you here. Today I am talking with Susan Kelsey, MFT, about children's therapy and different ways to get children to open up and talk about their issues. Welcome back, Susan.
Thank you.
So what strategies do and don't work when you're working with children?
Okay, that's a very good question. A lot of people think that you can sit a child down, like we talked about before, and just talk to children and lead them into some sort of insight about their behavior, but that isn't really how I have found therapy to work. They say that actually play is the language of a child, certainly up to about 12 years old. And so therapists who are specifically trained to work with children using play. And there's all sorts of play activities that can help a child work through, understand, and address the issues that bring them into therapy.
So what doesn't work with children then? Just trying to sit them down saying, hey, what's the problem here? Like you would kind of with an adult when you begin getting frustrated that you see that they're suffering and they're stuck.
Yes, that's a good question. Well, children don't respond very well to direct questioning, I've found. They are embarrassed sometimes, especially if you're not a family member, and they oftentimes don't even know what it is that's causing them problems. So that doesn't work very well with a child.
So Susan, can you tell us what play therapy is and how it differs from just regular everyday therapy and everyday play?
Yes, that's a very good question. Therapists who use play therapy have been trained to assess and treat children using play, and they have specific toys in their playroom that are cover the child's entire emotional experience. There's rules about the toys we have to have in there, which are toys that are nurturing toys, industrious toys, aggressive toys, so a child has a way of expressing all of the parts of them in the play experience. The toys that we don't usually invite into the playroom are toys that already have a specific meaning attached to them, like Disney toys, for instance, who maybe came from a movie, and when the child plays with that toy, they recreate the movie instead of playing out their own experience. So what we hope that a child does with the toys is take the toys and play out their life with the toys. And in order to do that, we have to have toys available for them to do that with, and we have to provide an atmosphere that allows children to take the toys in a safe way and not feel shame or blame or any sort of direction toward the toy play that they are doing in the playroom. So play therapists are taught ways of responding to a child's play that allows the child to feel safe and to play out their life in a way that is uninhibited. And that usually works a little better without the parents in the room, to be honest, because they do filter their behavior oftentimes for the parents. But sometimes parents are in the room, and oftentimes, or when it's needed, I actually do what's called filial therapy, which is teaching parents how to do therapy with their children at home. So in certain situations, I will actually teach the parents to respond the same way a therapist would in order to allow their child to have some home time to do this, which is a very bonding experience between parents and children. Oftentimes I use those when there are some sort of attachment issues, adoption, or I feel like the child needs a particular strengthening of the bond between the parents. So those types of things would be how a therapist might use play for a child.
Yeah, and we'll go into that in the next segment, specific interventions, how you work with the parents in particular, and because that sounds fascinating. It sounds like that could be a whole session upon itself, just trying to get the parents involved and let them take the next steps in helping their child to heal up and understanding better about what exactly they're going through.
Exactly.
So that would be wonderful to go through those little steps and understand that whole process a little bit better.
Yeah.
So we'll be talking more about that in the next segment. We're going to take a short break right now. Be back.
My name is Dr. Sagert. I'm a board-certified psychiatrist. I can provide medication management, psychotherapy, either individually or in group setting, and also I provide couple therapy. I have experience working with severely mentally ill patients, as well as substance abusers and highly functioning people. My website address is www.drsagert.com.
Hi, welcome back to Psych 1-on-1 on Therapy Cable with Susan Kelsey, MFT. And Susan, we were talking about a little bit of intervention work with children in therapy. Can you give us a little more specific interventions and techniques that you'd like to use?
Okay, thanks. As a trained play therapist, we learned how to do directed and non-directed play. So directed play is when you give the child specific work to do that are called interventions, or little projects, I would say, that have specifically designed for a purpose, like to maybe elevate their self-confidence or to give them more self-control or whatever. I have dozens, maybe hundreds of interventions to help children deal with whatever they're struggling with. Some of those, they're all fun, and the child enjoys them. The child always has a choice of whether they do them or not. And usually I use these for children who are 7 and older who choose to have a more directed approach. Some of those examples of those would be, let's say a child is going through divorce and they're very upset and they're feeling very sad. We might do an intervention I have called the good news tree and the bad news tree. And that intervention is you have the child draw 2 tree trunks on a paper, and I have previously cut out of green construction paper leaves that are big enough to write on. So I might ask the child, tell me something about your family going through divorce, and they might say, well, my daddy doesn't live here anymore. So I would say, okay, would you like to glue that on the good news tree or the bad news tree? and they get to choose. Never assume where they're going to glue it, because sometimes something you might think is good news is bad news, and vice versa. And then you can see at the end if the tree is filled with, if the bad news tree is filled and the good news tree has nothing, you might be able to offer them some good news to balance them out a little, to help them, like, well, maybe it'll be a little quieter in your house because your parents won't be fighting anymore. Would that be better? And then you can glue that on the good news tree or whatever. Or some things are changing, many things won't be changing. You can glue that on the good news tree. Mm-hmm. So that is an example of one intervention I might use with a child that is fun for them, and it lets them look at the issue and decide for themselves what things might be positive and negative about the experience. Mm-hmm. So that would be an example of a directed intervention. And there's the other approach is called non-directed play therapy, which is the child completely chooses on their own the direction they want the therapy session to go. Mm-hmm. They play with whatever toys they want to in the way they want to play with them. And the therapist is trained to respond to that play in a way that facilitates their expressing themselves. So a child might choose to play in the sandbox that we have. It's called a sand tray, and it's a small box filled with sand that the child can put little miniature things in, and then oftentimes we write a story about the miniature things that go in there. The child, you can also do a combination of directed and non-directed, in that the child might be completely non-directed and doing something, and it might lead into a more directed activity. So the play therapist is trained to help children use their play in a way that facilitates their healing.
So typically, Susan, when a child comes in to see you for therapy, how do you start the sessions then? Do you let them choose what they want to do, or do you do the directive therapy? How does that usually go?
I usually give the child a choice. So I tell the child, the very first session, when the child comes in the playroom, I say, this is the playroom, and in here you can play with the toys in any way you'd like to play with them. Mm-hmm. And of course, there aren't very many rules in the playroom except for safety. Mm-hmm. So I tell them that, I actually don't tell them the rules until they break it. And then I might say, well, that's not for throwing, but this is for throwing. Mm-hmm. So I give them an alternative so that they understand. But you try to make the playroom as child-friendly as possible, so there aren't a lot of limits and rules, so they can do what they want to and need to in the playroom. So I don't usually say to the child, do you want to do this or do that? I might let the child choose. I say, you can play with whatever you want to today. And sometimes children say, well, I'd like you to find something for me to do. Mm-hmm. And I might offer an activity. And one of the rules I tell children the first day in the playroom is that anything I ever ask them to do that they don't want to do, they don't have to do it. Mm-hmm. So they know they always have a choice. So another activity that I use oftentimes with kids is a coping skills bag. And that is a bag that the children decorates, and the child would decorate with stickers and whatever they want, glitter, and they make their bag in one session. And then every time they come, they get a different coping skill to go in their bag. Like they get a squishy ball, a stress ball, they get bubbles for learning how to take a deep breath, they get all kinds of things, a worry stone. They do a lot of sewing in the playroom, mm-hmm. and one of the things they sew is a little gnome, and it can be a gnome that can do whatever they want it to do. Like there's friendship gnomes, there's worry gnomes, there's homework gnomes, mm-hmm. there's all kinds of gnomes that kids make and decorate and put in the bag. So it's all fun, all directed to a child's developmental level. Mm-hmm. And one thing I like about the coping skills bag is that it gives the child responsibility for calming themselves down. So a parent can help with the bag by saying, it looks like you're getting very upset right now. Why don't you go get your bag and find something in there that will help calm you down? And so the parents can help, but the child eventually, hopefully, will be able to go to the bag themselves and find some calming activity and be able to regulate themselves rather than depend on the adults to do it for them.
So Susan, what should an adult or a parent who's looking for a therapist that's qualified to work with their children, what kind of qualifications should they be looking for?
Okay, that's a very good question. Unfortunately, therapists are not trained in graduate school to see children. There's often, at the most, one class in treating children, and some schools have no classes in treating children. So therapists need to get a lot of extra training to be able to do this kind of therapy. So I would say to a parent that if you're looking for a therapist for your child, definitely look for a therapist who has experience seeing children, and ask what that experience is, how long they've been doing it, what kind of training they've had seeing children, if they've had special training in this or not. So you would have to, there's some ways that you can find therapists who are specially trained. I would seek out those sources. So definitely, if the therapists say, well, I see teens sometimes, but I'll see your 7-year-old, I don't think that's probably going to be a good choice for you. I think you need somebody who's used to seeing small children.
Mm-hmm. That's good advice, definitely. So when we come back for our next segment, we're going to talk about children when they're traumatized and what to do specifically for that. And so we're going to take a short break. We'll be right back with Psych 1-on-1 on Therapy Cable.
Hi, my name is Leanne Marquez. I'm a marriage and family therapist intern, and I work with biofeedback and neurofeedback as an integrative approach in therapy. And what that is that it's a body scan, and it scans your body or your brain waves that gives me additional information about you. And these things could be unconscious, and that helps me with your therapy and helps you move along quicker. Also, I'm offering a free session, 20 minutes for you if you contact me. And I work with children, I work with adolescents and adults. So contact me at journeytobecomingwhole.com, or my number is 949-478-2324. Thank you.
Hi, welcome back to Psych 1-on-1 on Therapy Cable. I'm talking with Susan Kelsey, MFT, regarding child therapy. We are going to be talking about children in trauma, which is a very specific occurrence that can really impact a child's life from the time of trauma on through adulthood. Can you talk about a little bit about what you do with traumatized children?
Sure. Yes, oftentimes children come in to see me and they have experienced a traumatic event. And when a traumatic event is actually an event that's so overwhelming for a person that it's hard for them to move forward from that event, and it seems to live in them and impact them oftentimes the rest of their life if they don't address it. Mm-hmm. This happens with soldiers. We've talked a lot about PTSD and soldiers, and there's a lot of ways a person can be traumatized. There are several factors that impact whether a child will be traumatized by a specific event or not. Some of those factors are their attachment to their parents. If a child has a secure attachment with the parent, they're less likely to be affected by trauma. If a child has a less secure attachment, for instance, was born to a drug-addicted mother and did not get their needs met as an infant, they might be more susceptible to trauma. Also, a child who has had a history of previous trauma, the more trauma they have, the more susceptible they are to not processing that trauma like they need to. So, and another factor is just the child's own temperament. Mm-hmm. Some children are just more sensitive than others, and where one event may severely impact a child, their brother or sister may not be impacted at all by the same experience. So a lot of it is just personality or temperament. But when therapists treat trauma in children, they have to understand how trauma manifests itself in a child's body. And what we do know is that trauma lives in your senses. So when you have a traumatic experience, for instance, if you're driving down the street and let's say you just picked up a pizza and you're on your way home and you've got the pizza in the front seat and it smells real good and you have your favorite radio station on and you're driving along and you just pass a 7-Eleven and you think, boy, I didn't know that 7-Eleven was open or whatever, and all of a sudden your car is hit and you have a terrible accident, those experiences that came into your senses at that time are stored in your senses and stay there until they're let out and able to process. So later, when you recover from the accident, you might find that the smell of pizza is very disturbing to you or can take you back to that moment in time when that accident occurs and makes you very anxious. Or seeing a 7-Eleven or hearing your favorite song on the radio. Those are called triggers, and oftentimes soldiers get those. They'll maybe hear a book drop and think they're back on the field where there was shooting. So those are things that are not held in your brain where we usually hold our memories, our cognitive memories. They're held in our senses. So therapists who treat children who have been traumatized have to understand where those memories are held so that they can actually provide interventions or ways for that child to move that trauma through their body and out, because it just gets stuck there. There's a feedback loop in your body when you go through an experience that's terrifying to you, where adrenaline is released and then cortisone is released to remove the adrenaline, and one gets you all excited and the other one calms you down. And children who are traumatized are stuck in that feedback loop, so they become what's called hypervigilant. Everything that moves around them, they're hypersensitive to. So in order to break that cycle, you have to allow ways for the body to release that trauma. So therapists who work with children find physical ways as well as other ways for children to actually work through the trauma and be able to release those things that are stuck in them.
That sounds fascinating. It sounds like that would be a really challenging work for you to do and for the family to have to process, and maybe a little extra time in therapy. Is that correct?
That does take a little bit more time. It can take significantly more time depending on the trauma and the impact on the child.
Okay. Now, what about self-soothing techniques and children's natural ability to heal up from a lot of the psychological things that they go through?
Well, children have amazing ability to heal themselves. Those of us who work with children don't try to fix them. We try to reconnect them with their own resources, which they already have. So it's amazing when you see what a child can do, and they inherently know what they need to do, which is why it works best with traumatized children oftentimes to let them completely design their own therapy, because they work best in the way that works for them. For instance, I had a traumatized boy who took about a dozen sessions to get to the point where he could do this, but he started writing a book about his experiences. And every therapy session, he was about 9 years old, and every therapy session was a different chapter of the book. And so that's what he needed to do. I wouldn't impose that on another child if that isn't the way they would work. He designed that himself. So children usually design what they need to do to work through that experience. They're amazing. And so you have to just trust that children, given the proper tools, will be able to heal themselves.
I agree, definitely. So if the viewers would like to contact you, where can they contact you?
Well, I have a website. It's SusanKelseyMFT.com, and that's KELSEY. And my phone number is 800-890-1962. My office is in Costa Mesa. And there's also some resources I have for them that they may be able to read on their own if they suspect that their child has been traumatized or want to read about it. There's one called Trauma Proofing Your Kids, actually, by Peter Levine. And he also wrote another book called It Won't Hurt Forever. And those are helping parents also instill resilience and healing in their children. So parents can be a big part of the process and are a big part in a process of their child healing and moving forward and having a successful life.
Yes, it's huge, and it all does work together.
Yes, it does.
So, Susan, I'd like to thank you so much for being my guest.
You're very welcome. Thank you for having me.
Thank you. And thank you for tuning in to Psych One-on-One on Therapy Cable. Join us on a weekly basis. Take care. Bye-bye.